Everyone. Aspiring engineer here. Welcome back. Today I have a special guest, a real engineer. This man has been a mentor since my days in the Boy Scouts, and he works as a mechanical engineer in the biomedical industry. In the span of less than your lunch break, he will drop some excellent pearls of knowledge that we aspiring engineers can take to the bank. I understand if you can't dedicate your entire lunch break to our conversation, so down in the description I've actually included a table of contents so you can skip to any portion of the interview. Now, without any further ado, please welcome Chad Patterson. Hi, Chad. I just wanted to say how grateful I am because not only have you been a friend and mentor to me, but not everyone has a Chad in their life. So I'm grateful that we can share the wisdom that you're about to impart, not only with me, but with everyone watching this video. And I think that's awesome.
I'm here for.
I'm in college now, and I assume many of our viewers either are in or considering engineering college. Do you have anything to say about college?
The beautiful thing about going to college is you get to focus into an area and you get exposed to specialties within that area. And it can be a very discerning time in your life to go, ooh, I really don't like that. Well, whatever led you to that point, stick with it. Make sure. Because even on a good day when I'm doing my job, there are going to be things that pop up. I really don't want to do that, but it's part of the job. It's part of the career. Be persistent in your pursuits. Don't just stop at that first roadblock. Go around it, go over it.
How do you relate your own mechanical engineering degree to the realm of biomedical?
Biomedical is a field, and my experience with folks in biomedical is that a lot of them get a great deal of anatomy and physiology training,
Yeah.
and they have the ability to go on into the medical field. Whereas me as a mechanical engineer, I really didn't have that much training in biomedical activities. I didn't know anything about anatomy. I didn't know anything about hard tissue, soft tissue, physiology, biological activity. I really didn't know anything about that when I joined my first medical device company. But through immersion, you pick it up because typically as an engineer working with physicians and working with technicians and sales and marketing people, they're trying to overcome a particular condition or they're trying to help somebody out with a particular injury, whether it be degenerative or whether it be traumatic. And you pick up those things, but the underlying mechanical things that I was taught in school, statics, dynamics, physics, strength of materials, static and motion in mechanisms, that's all what I've applied trying to solve these problems.
Very cool. So it's not like a one of those majors where you're like, no, we never use any of it because the real world's totally different.
Well, with very few exceptions, in my humble opinion, biomedical engineers aren't given the tools. They're not given a whole lot of CAD. They're not given a whole lot of the core mechanical engineering tools. But I have met some phenomenal biomedical engineers that were mechanical engineers in medical devices. I think it comes down to that. I think you and I talked about this. It comes down to that basic aptitude, that mechanical, three-dimensional thinking, problem-solving type approach to things. And like me, a lot of people just pick the tools up as they go along. And they come across people that know how to use them already and they learn from them. I mean, that's what people do is we learn. A lot of times what we try and do in medical devices when we're dealing with physicians and caregivers is we ask them questions like, what do you want it to do? Not how, but what do you want it to do? And we can get into, okay, you want to get this particular implant into that space. How do you want to get there? And that's where you kind of have to, you have to balance, because I've never touched a patient. I've never done an operation. I have no idea what it's like. But I know how to make things, make a stick that you can put a fancy shaped rock on and put it inside of somebody. I know how to do that.
That's very cool how you illustrated that you don't exist in a vacuum. You're not just chained to your cube all day. You actually are working with other engineers and other experts to make a very complex product.
Another engineer that I worked for many, many years ago, 30 years ago, he taught me the rule of four. Is it legal? Is it ethical? Is it moral? And is it profitable? And the only thing that can be thrown off the list is the profitable. The other three have to be met when you're dealing with treating patients with medical products. Not everybody can look at a blueprint and go, okay, yeah, that'll work, or no, you can't make that. So we have to be the ones that are very conscious, very conscientious, and hold ourselves to a high standard to make sure that what we're doing is is a safe and effective treatment method. And that's the same no matter what industry you get into.
My next question is, do you have any projects that you're working on now, and what do you do when you're on those projects?
I'm at the beginning of the project, and most typically at the beginning of an engineering project, you look for ASTM guidance documents, you look for FDA standards because we're in a regulated industry, um, and you try and figure out, okay, what kind of hurdles do I have to overcome to do this thing that they want me to do? Then the next step typically is looking for things like these
Patent
make
application.
patents. Has anybody else done it? Are there any hurdles associated with trying to do it that way, or can we do it our way? And there's two aspects to patent law. There's freedom to operate, which means has anybody else patented what I want to do? And is there novelty? So in engineering, typically the projects that I work on, the first thing you do is you go looking for ASTM standards so you can figure out how you're going to prove that this thing is safe and effective. Then you look at FDA guidance documents because again, it's got to be legal. You look for those guidance documents that the FDA publishes and you go, okay, we've got to do this test, this test, this test, and we've got to compare it to this device and that device. And we've got to have this proof that it is in fact safe and effective before we put it in the marketplace. So I'm in that phase right now. So I've been reading patents for about 2 weeks and I've been reading FDA documents for about a week. Because we want to make sure from a company standpoint that we know the risks associated with bringing a product like this to the marketplace. We're well aware of what they're going to cost, and we think that we've got something that's going to succeed in testing them to prove it. That's typically the beginning phase. At the same time that I'm doing that, I'm trying to develop concepts using CAD, I've got a really nice 3D printer here, so I'm using that because 3D printers are wonderful. You can show somebody a CAD model of something, but if you can't actually demonstrate its function, again, being engineers, we can look at a CAD model and go, yeah, that'll work. But we're trained, we're experienced enough to go, yeah, you can make that shape. But there are I'm guilty too. Some of us can put things on CAD that can't be made or won't work. And that's where 3D printing is such a benefit. Plus, with 3D printing advancing as fast as it is, that's going to be a production method in the future. That's going to be how we make a lot of stuff. It's not really quite there yet, in my humble opinion, but it's getting there. So, which the
Very
fun
cool.
part
Yeah.
is, it's going to be able to make it so that we can make stuff that you really can't make.
But a lot of people kind of have the stigma like, I'm going to be an engineer because I just want to make things all day long. And from what you've said already, that's not necessarily true. I mean, you've definitely described your job function.
Mhm.
Um, but I guess if you were to break it up like with a pie chart,
Sure.
what would your days plural be spent doing where, so much percent of time, like, I don't know, research or patent research, or does
Well,
it vary?
a lot of it depends on the time in the project. Projects typically follow phases. You've got your conceptual phase, you've got your design phase, you've got your development and testing phase. Maybe you've got, in our case, in medical devices, you've got your regulatory review phase, and then you've got your design transfer phase. There's typically 5 to 6 phases in most projects. During those phases, the pie chart's going to change. Conceptual phase, you're designing like crazy. You're gathering information as fast as you can, and you're designing like crazy to present possible solutions. Then at the gate point where everybody says, yep, that's how we want to do it, you move over into the design phase and you're doing drafting and specification writing and you're researching all of your standards and developing for the next phase, which is the testing phase. Okay, this is how we're going to test it. This is how we're going to prove it. Then you're putting that all together, and you might switch into a phase where, okay, now I'm documenting all of the conceptual activities and all of the design activities, because in medical devices, I think this is the case for most ISO, International Standards Organization companies, you have to maintain a history of your design. It's called design control. And you have to maintain a history of all the phone calls, all the emails, all the Zoom meetings, all of the things that were part of the project to get you to that point, because you're going to use that to build up a case, a record of all of our activities that show that we were compliant with our standards and compliant with our quality system, and have a record to prove it. So a good quarter of my time, 25 to 30, maybe even 40% of the time, I'm documenting everything that I do. I'm capturing that information into the system of quality control that the company has, and I'm making sure that I'm building a foundation of documentation. Once you start getting to the point where you're done your testing and you're compiling all of your documentation and records of proof and submitting it to your compliance organizations, whether it's Food and Drug Administrations, whether it's the medical device agencies in Europe, China, and Japan, that's a point where typically engineers like me, we go back and make sure that all of our design control is documented properly, and we start making sure that we've had that audited by our quality and regulatory folks within our company. So there's a lot of times that we're spending 50%, 60% of our time doing the dreaded paperwork, but that's where we're at. And then when we come to the design transfer phase, where we're taking our little drawings and we're going to manufacturing, well, the smart engineers like me, because I've done it the wrong way too many times, started way back at the beginning, talking with our manufacturing people about the processes, the method, before I put mouse to screen to create drawing number one, or fingers to keyboard to type specification number one. I've already talked to my manufacturing folks, my partners, and said, can you do this? Can you do it repeatably and inexpensively? Yes, no. Okay, management, this is what they think it's going to cost. Yes, no. So that's a cyclical process that's going on all the way through the 5 phases that we typically use in medical devices. Because if it's not profitable, again, if it's not profitable, you can't do it. You can't bring it to marketplace and continue the investment in new devices and new innovations to bring to the marketplace. And then during that design transfer phase too, a lot of times what will happen is you commercialize, it goes out into the field, and they go, it's not quite there yet. Can you tweak this? Can you tweak that? So oftentimes there's another mini loop on the end of what we refer to as alpha launches. Okay, the first people to use it are the ones that helped you design it. And they've been your partner throughout the process. You've kept them steadily up to date throughout the process. And then they actually get in front of the patient, and they go, ooh, handle's not long enough. Okay, let's fix it.
That makes a lot of sense, especially when we're always hearing about video games or other things that are in beta or alpha. Um, I guess my next question is, in a broad sense, how many different hats do you have to wear in your job?
To give you the definitive answer, there's probably 3: design, research, documentation. There's probably 3 major areas of work in my field of mechanical engineering, and they vary. They change the amount of effort depending upon the phase.
Yeah.
And the key thing is to be flexible. Okay, I can't always spend my time on the CAD because I've got to document all this stuff. Or I can't dig down into the documents and spend my time digging through and researching all of the things I need to know about this, because I got to get over onto the manufacturing interface and make sure that they can actually make it, and have them look at it and go, I can't make this pretty picture, engineer, sorry.
Now, is your job one where you're actually going onto the machine floor and
Oh, absolutely.
yeah,
Absolutely. I stay as close to manufacturing as I possibly can. I stay as close from the standpoint of knowing the people that are the experts and knowing what they can do, so that I don't create a pretty picture. We call pretty pictures in engineering something you can't make, or you can't make profitably.
Hmm.
And I make sure that they're partners. Engineering comes down to finding other source experts, people that are skilled and talented and capable and trained and have equipment to make the products that I make. Because as a mechanical engineer, I typically make products. There are mechanical engineers that make services, but I have always made products. So since I don't run machines, I have to go find these people. And I've always found, just like keeping my CAD skills up for 30 years, even though I've been at senior director level positions where I've managed large groups, I've always kept my engineering skills because that's what drew me to the field to begin with. I enjoy solving problems by finding mechanical systems and methods to solve those problems.
It's cool to also hear the echoes because I've talked to other engineers as well about how very important it is to provide clear documentation of what you do because inevitably you or someone else is going to go back and try and access that. And if you leave a rat's nest behind, it can make someone's job, someone's life very difficult.
Oh,
Um,
absolutely.
what you said was you do talk to the manufacturer at the start,
Mhm.
and it's something that they just started talking about to us in class, where you start all of the processes to get a product made at once, the accounting and
Mhm.
manufacturing and all those talks, um, and then you by the end of it, hopefully you'll have a product sooner than if you had to do it one by one.
Believe it or not, Alex, as an engineer, you're going to be selling your ideas to management, to sales, to marketing, to the manufacturing people, to the regulatory people. So having a relationship with them based on credibility and integrity, again, circling back to integrity, is very important. You always tell the truth. You always tell them what you can do, what you can't do, and you stay in the middle of what you're able to do so that you're not over promising or under promising, but you're driving right down the middle. That builds relationships within an organization that you can use to do great things.
Well said. What are some takeaways from engineering that you can share with us?
You've heard the question. It's a typical silly interview stock question. What are your strengths? Well, I don't take I don't stop if I fail. I keep going and I learn from my failure. Do you have any weaknesses? No, because I don't accept failure. Weakness is a failure. Okay, well, if I take failure and solve it by I keep going, or I learn from it, or I go find somebody who's smart enough or has done it before, well, then I won't fail again. So it's no longer a weakness. Overcoming challenges, overcoming hurdles and obstacles, using your intellect, your three-dimensional thinking, your inquisitiveness, your curiosity to overcome failure is always the best solution.
I'm sure you have advice to students. What would it be?
The learning started back in school, but it's never stopped. It's not something that you just, okay, I got my degree, I know everything. No, that's just the beginning.
Yeah.
And the best part about it is the learning. Every company that I've ever gone to, whenever I've changed from one particular treatment to another particular treatment, that's a whole bunch of new stuff I get to learn. To me, that's what I enjoy. Learning things, applying it, taking old lessons, bringing them into new areas. Find the thing that you love to do most, something that just brings you overwhelming joy, and learn the skills and be persistent to do it better than everybody else. And rewards will find you. I used to take stuff apart when I was a kid and I'd put it back together in a different way. Sometimes I'd have spare parts and sometimes I'd need other parts. But I got really good at it, and that's what led me into engineering.
That makes sense. Are there any like counterintuitive examples from college maybe that made you into a stronger engineer?
Comp
Absolutely.
was comp was one of those areas where a lot of engineers when I was in school, got clobbered by. Well, I don't write. Well, how are you going to convey your ideas?
Hmm. Yeah, and I guess that you could probably apply that more broadly too, right? Where whatever you do, do it to your fullest capacity,
Yes,
because
always give
otherwise it's not worth doing, even if you don't like
always
it.
always give your best. I do my very best even after 32 years. I'm still learning new ways to do it. I'm learning new skills. I'm learning new techniques. I'm learning new methods because that learning is what keeps me better at it. so that people like these people here who are so very kind to me have offered or have are rewarding me for doing that type of work for them. Do what you love and you never work a day in your life. And a lot of us have heard that, but it's true because the 30 years that I've been in the industry have gone by like that because I love what I do. Spending time on a Saturday late at night sitting there thinking, how am I going to solve that problem? It's what I love to do. And I try to do my very best to do it well.
Do you have a most memorable career point?
I worked at, right out of college, I worked at a company up in New Hampshire called Pitco Fryolator. They're still in business. They make deep fat fryers. You go to McDonald's and you have French fries, you're eating French fries that were cooked in a Pitco Fryolator that I was part of a pretty good sized design team for back 35 years ago.
Hmm.
I'm sure they've upgraded and advanced, and there have been many iterations since then. But about 6 months ago, I got in touch through the internet with the project engineer that I worked for. He's still there. He remembered me.
Wow.
I was just a little designer. I got the job because I knew how to drive a CAD before anybody knew how to drive a CAD because I can't draft. My handwriting is very terrible. So I learned how to use AutoCAD. And when I walked in the door and sat down at their CAD system, I was able to draft right away and they hired me. And I got to work with this great guy. His name's Steve. He's still there. He started in the paint shop. He was painting. And they noticed in him that he was persistent and curious and intelligent and motivated. And they moved him up through engineering and paid for him to go to school back at a time when that was very unusual. Back at that time, it was very unusual for companies to pay for an employee to go to school. He went to school, got his engineering degree, went to work, and he was working on projects that were very complex. And at the time that we were working on the McDonald's specification, it had some unique features that are still used. I mean, if you look at a Pitco Fryolator at a McDonald's anywhere on the planet, it's got the two side-by-side units and the underfilter system that we designed, the original, the great grandparent probably by now. And it's very fulfilling to me that he remembered me. He sent me a photograph from a company party. I'm this skinny little kid with hair standing between these three other huge older engineers. And one of them's got his arm over my shoulder. It's probably one of my more memorable times, and it was a long time ago, but it's always taught me that, yeah, if you do your best, give everybody your best, and you try your hardest, people remember it, people appreciate it, and people benefit from it. And that's what we're here to do.
I think that's so awesome that your favorite memory is of the people you worked with. It's truly been a pleasure talking to you. Do you have any parting advice for young people like me?
Accept failure. Avoid it when you can. Be persistent. Always give your best effort. Always be honest with yourself, with other people. Always do what's right for anybody and everybody you meet, regardless of the circumstances. Do your best. Be kind, be considerate, be understanding, and be accepting of the fact that sometimes you're going to be asked to do things that are hard. But you were put here with a gift and a talent. All you got to do is put a little drive behind it, and you can be successful, and you can do great things for people.
Words of wisdom. Thank you, Chad.
It's my pleasure. I appreciate you asking me the questions. It's a very kind compliment that you would ask me to speak to you.
Well, I am honored that you took the time out of your day to help me and everyone watching this video. Speaking of the people watching, if you missed any part of this interview, remember that I have put a table of contents in the description below, and you can go back to any part of the interview and hear what Chad has to say about it. Thank you for tuning in. This is the Aspiring Engineer signing out.
I have hair. I have proof.
Had hair. I guess that counts.
Yeah. It's kind of migrated.